Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by VillageMD, primary care physicians. Practice medicine the way you've always wanted. Data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of VillageMD, and today is an extra super bonus episode to accompany our E&M coding episode, so we're so glad to have you here. I'm thrilled to introduce Kristi Lee. Kristi, how are you today?
Hi, Wendy. I'm great. Thank you.
Kristi is our Director of Revenue Cycle from VillageMD and very experienced revenue cycle professional. And I'd also like to introduce Janessa Nelson. If you've listened to the podcast, you know Janessa is our legal operations expert, and she's formerly a scribe. So she's done a lot of work with these E&M codes and modifiers. So Janessa, how are you?
I'm doing great, Wendy. Thanks for inviting me back. I think just as a little refresher, especially since we're talking about modifier 25 and modifier 59, these really come in when we talk about bundling different payment services. Is that correct, Kristi?
That is correct. So we use these modifiers to help tell the payer that we have provided additional services. Do not bundle them. They need to be paid separately.
Just as a sort of evolution, we started with you get paid for everything that you do. And then we moved on into the bundling, which is what we're talking about now. So E&M, fee for service, physician fee schedule, bundling. And then now we're sort of moving into HCC codes, which are different. And we're not going to get into it here because we're concentrated on modifier 25 and 59 today, but just as sort of as a overarching message to everybody. So Kristi, what is a modifier 25? Because I know sometimes it can be hard for me to determine if it needs to be added in. It can be hard for physicians to determine if it needs to be added in. So let's just break it down, meat and bones. What is it?
So modifier 25 is used to unbundle procedures. So typically payer will say everything's grouped in that one evaluation and management code that you did during that day. Well, if you're dealing with two very significant procedures or two very significant identifiable evaluation and management services, such as dealing with a out of control diabetic patient as well as doing the annual wellness visit, or you're providing a evaluation and management service and then need to provide an injection procedure, you would use that 25 to really say, I need to be paid for both of these.
So just sort of doing an x-ray for a foot injury doesn't necessarily qualify. Is that correct?
That is correct.
But if you were to evaluate that you had a foot injury and then additionally also perform injection for your arthritis, would that qualify?
That would qualify. So
Okay.
you would then put the 25 on your evaluation and management code and bill that injection code. The reason you don't need it on the x-ray is it is a standalone, significantly separate procedure that would never be bundled in an office visit because it's typically performed on its own. So they would just pay for that regardless. It's not bundled.
Got it. That makes a lot of sense. So I think the most important note for all physicians is the documentation requirement for the modifier 25. So can you walk me through what is needed in order for me to qualify for this?
Absolutely. So in the situation where we're talking about that preventive medicine visit as well as an evaluation and management, you need to make sure that you're clearly documenting all the elements of your annual wellness visit and then separately documenting your evaluation and management, which would be your history, exam, and medical decision making for that specific reason that you're treating. So you would call both of those out. For the procedure, you need to make sure that you've documented your history, exam, medical decision making for your evaluation and management, as well as the injection was given showing the order and the reason that you gave that injection.
Great. And I think the most important note for all of our physicians is that the documentation should be able to stand alone, and you should be able to bill separately for these different issues or procedures that you performed. So there's a lot of mistakes that get done with modifier 25, right? We have a large list mostly pertaining to surgeries, but that's not necessarily relevant to our physician partners. Can you just walk through what you're seeing a lot?
Yeah, so most of the times when I see the 25 modifier being used incorrectly, it's when they did not perform a significantly higher service or identifiable service. such as the patient came in and we did annual wellness visit and we just refilled their medications for their chronic conditions, but we didn't actually perform above and beyond our annual wellness that would justify an additional E&M service. So it would be inappropriate to put a 25 on there.
Great. And let's just look at a couple real world examples in the wild modifier 25. So the first one, let's go through when we can use it to give physicians some context. So I'm seeing here, established patient is seen for a finger laceration. So during the visit, the laceration is sutured by the physician. And then additionally, the patient also is requesting some help with some sinus troubles. So is this okay to use the modifier 25?
In this case, it is, because you're actually dealing with two separate problems that you need to evaluate independent of each other, right? So he's evaluating the finger, he's going to repair that, so you're going to bill that procedure code for repairing it. And then he's also going to address the sinus problems. And in that case, he would assign an evaluation and management service that would cover that.
And it's important to note that when you're documenting, make sure that you have distinct HPI, exam, and MDM for both the sinus issue and also the finger laceration. So I'm seeing that the modifier 25 is applied to the E&M. Is that correct?
That is correct. The 25 modifier should always be placed on your evaluation and management CPT code. It should never be placed on your preventive medicine code or your injection code.
Really helpful information to know. Okay, so next one, not to use. I bet that we see this a lot, right? So an established patient is seen for a foot injury and an x-ray is then performed to rule out a fracture for the foot injury. So are we okay to use modifier 25 in here, and why or why not can we?
No, so you really wouldn't need a modifier 25 because you're not performing two significant different services. You're just performing an x-ray and you're billing for your evaluation and management. That x-ray code is not a bundled code. So if you look in your coding guidelines, there are certain procedures that are not bundled. They're always able to be billed in addition to evaluation and management. And this would be one of those. So placing a 25 would be inappropriate.
So let's move on. There's another modifier that you might have heard about, modifier 59. So what is modifier 59?
So modifier 59 differs from the 25 in that it's applied to procedures. And you usually use this when you're performing two distinct procedures or multiple procedures in the same visit.
I think the issue is they have to be sort of distinct, right? So like it really helps if it's a different issue or a different body part where you're doing the procedure. Is that correct?
That is correct. Or you're performing two injections on two different areas of the body. It's not a single injection with two medications in it, right? Or it's not just because you have two different diagnoses. You're actually performing two different services.
Great. That's really helpful to understand. I see here that typically it's ones that would not be bundled together under one code. So if you're doing sort of specific sort of type of injection where you have multiple medications, that wouldn't qualify, correct?
That is correct.
So common mistakes, I mean, this one's a really challenging one because what qualifies as two separate procedures. You see a lot of these being misused.
It is the number one reported most misused modifier according to CMS guidelines.
Wow.
So it's high on the OIG target list when they're looking for usage.
So let's just give a few examples for our physician partners to see how they might qualify in the wild and when they should not be used. So let's do the first one, when they should be used. A patient presents for a cold and the patient is given a dexamethasone injection for their sinus issue / cold. And then in addition, they also have arthritis. And at the same visit, they're given a Kenalog injection for the patient's arthritis. Would this qualify as a modifier 59?
It would. It would also qualify as a modifier 25.
Wow.
In this case. So it kind of links the two together, and you'll see that because you're doing both an evaluation and management for that cold and sinus congestion that the patient has. So you had to evaluate that in order to determine what you wanted. And then you decided to give an injection for that. So that's where your 25 came in to say, I need to get paid for both the injection and the evaluation and management in this procedure. And then we also gave them their Kenalog injection for arthritis. So that is a separate service and a separate injection for a totally different reason. So you would bill for both of those.
Well, so we can get pretty complicated. As you can see, we have all of the codes that you can bill for just this one encounter. So I'm seeing a modifier 25. I'm seeing 2 different medication injection codes. I'm also seeing then 2 different procedure codes for those injections. And so tell me how to apply the modifier 59.
Right. So in this case, because we gave 2 distinct injections, we have 2 administration codes that we need to bill. And in this case, it's the same administration code. So we have to tell them that we gave 2 and it's not bundled, right? So we would apply the 59 on the second administration code to highlight that that should be paid in addition, that it's not a duplicate charge.
And I think that's really helpful for all of our physician partners, is that you can only pretty much use the modifier 59 if you have 2 distinct administration procedure codes. And so the only time when you can apply it is on the second one. I think that's a helpful indicator for physicians. Now let's go into when you can't use it. So a patient presents for pelvic pain, and then also additionally in the visit, the patient is given a Depo-Medrol injection. Can we use it in this case?
So you would not use it in this case because you only performed 1 injection. So it's not a duplicate procedure or a multiple procedure in this visit. So you would not need to apply the 59. It would be inappropriate to put it on that administration code. In addition to this, it does matter that you put a 25 on there because you don't want your injection and your office visit to be bundled because you did perform 2 significantly different procedures during that visit.
So in this case, they could apply the modifier 25 because they did 2 distinctly different things. They did a procedure and a visit.
Correct.
But they cannot use the 59 because they only did 1 procedure.
Exactly.
Okay, that's really helpful. So key takeaways, what's in 1 sentence describe what modifier 25 is?
So I think the biggest difference between the modifier 25 and the modifier 59 is knowing where to apply them. The 25 is always on an evaluation and management CPT, and your 59 is always going to be on a procedure code.
That is really helpful, and I think a good breakdown for everyone who's having to deal with these really complicated E&Ms, figuring out when they apply, when they don't. So that's hopefully helpful. So with any of the handouts that Kristi just mentioned, if you want to get a copy for yourself, we can provide those to you through just replying to that email that you received from us, and we will get it directly to you in probably a day or 2 turnaround.
So thank you, Janessa and Kristi, for helping us with this is tricky but important subject. Thanks to all of you for listening, and we hope to have you join us again for this and other important topics.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.